Hello, welcome class. I am now starting to figure out a way in which we could get the class online. So this is part of our virtual experience by way of listening to videos of me and figuring out ways to integrate aspects of D2L in a way that we haven't before, but that is definitely familiar in terms of turning in assignments in a relatively straightforward way, etc. I have not figured out all the specifics and details thereof, and within the next week, I will be specifying and laying down a map of how it is that we're going to be moving forward. So I'm trying out the video as we could see here. Hello. And I wanted to share some thoughts that I had on the recent pandemic, the unprecedented COVID-19 pandemic and quarantine has us recognizing an involvement with the environment that is personal and communal. So the connection to the environment is simultaneously a health concern as it is an ethical concern. The personal way in which we have become hyper aware of our hands, hand to face, hand washing, eating, and proximal social distancing, all of this personal hyper awareness is an enactment of the body. We must will not to touch our face, our mouth. We must will to wash our already chafed hands for about 20 seconds. Then there's the avoidance of touching door handles and public surfaces in general. All of this is an involvement with the willingness of our body as determined by the desire to contain, avoid, and slow and or stop the virus. So the involvement with the body is coupled with an aim for the health of the body. We must maneuver the body so as to maintain health with something that we can't see. We must take its invisibility into consideration, and the unseen is also unnerving for the simple fact that its actual presence is somewhat unknown. We cannot, what can't be known with rational certainty is still contended with rationally. We aim to become cleaner in our habits, privately and publicly. Businesses are assuring us with improved disinfecting of surfaces and other avoidances of the invisible, and now ever present on our minds as a threat, something to be avoided. All these activities of involvement and avoidance with what we cannot see, a microscopic threat, are aimed toward our own good. Our hands are dry yet clean. We're quarantined for our own good to avoid exposure to COVID-19. We don't wish for the compromise of our own health. Likewise, we know that we can also unwittingly pass it on to others who are more vulnerable. The idea that we can unknowingly carry and pass on something that is potentially deadly is to be avoided. So we distance ourselves in the name of the good for the community. Meanwhile, as I said, I'm continuing to map out a contingency plan moving ahead, so stay tuned for updates on D2L, probably via email and also on our announcements page. So also get a good rest here for our 2-week spring break, and I will probably be posting stuff in the meanwhile here and there. So have a nice spring break, and we'll continue our conversation virtually. Goodbye.